So this could be a historic day when it comes to you, when it comes to your well-being, to your health, because you're going to get information from me that you don't normally get on a regular basis from mainstream and from other healthcare professionals or experts in my field. Tell your friends about the show if they haven't heard of it, or if they have but can't listen to it at this time of the day. It does replay itself on Sunday afternoon at 4 o'clock, the tape version of it. And, every week I sit and I think, what do I want to talk about this week? I got a lot to talk about. People were sending me all kinds of stuff this morning, yesterday, in regards to the interview that Tucker Carlson did with Calley Means and Cassie Means. Cassie's a doctor, yesterday. And Jesse Waters interviewed Calley, I think about 3 or 4 months ago. That's a guy, by the way. And if you haven't done this shit or if you haven't seen the interview by Tucker, you need to watch it on the internet. It's 2 hours. It's worth it. It's extremely enlightening because it supports what Dr. Fitness has been preaching for 25 years. How our healthcare system wants to keep us sick. How Big Pharma wants to keep us sick. How the food industry wants to keep us sick by making us sick by what they feed us. And the information that's disseminated down to us that are nothing but lies. So I'm going to share a little bit with you. By the way, you can type in, "You don't know how sick America is until you listen to this," and it will pop up. Then you can listen to it on YouTube. But here's some of the information that we get from this. It says here, Stanford-educated surgeon Dr. Casey Means and her brother Calley Means took center stage in a gripping interview with Tucker Carlson that aired yesterday. The health duo didn't hold back tackling the dangers of Ozempic, and I hear that advertised a lot on this station, the vaccine industry, birth control pills, and more. But the topic they really grabbed everyone's attention is how sick America really is. Like a human encyclopedia, Dr. Means listed an array of alarming health statistics, and you won't believe how bad the numbers are until you see them firsthand. Autism. Rates in kids are 1 in 36 nationally, compared to 1 in 1,500 in a not-so-distant past, which about 25 years ago. In California, it's even worse. Autism rates are 1 in 22. 74% of American adults are overweight or obese. It's probably higher than that. Close to 50% of children are obese or overweight. 50% of American adults have prediabetes or type 2 diabetes, when only 1% of Americans in the 1950s had the disease. 30% of teens now have prediabetes. Infertility is increasing at 1% a year. Sperm counts are decreasing by 1% a year. 40% of 18-year-olds have mental health diagnoses. Young adult cancers are up by 79%. And what's causing all of this? Our toxic food system and the toxic environment. That's how bad this is. So when I come on here and I preach, I'm actually doing this out of a caring nature. I had to find this out myself many, many years ago. When I came down with one of the worst, people that live in the valley know what valley fever is. They've heard of it. I got it. I got the worst kind. I got disseminated valley fever. And it was during my journey because when I was diagnosed with this about 1991, right after my second son was born, I was told a small percentage of people who get this kind of valley fever, okay, it's like 6 or 7%. That's it. And then it moves into the body. And it can attack any organs. Any. Brain, prostate, you name it. Lungs, you name it. And it was during my journey to keep myself alive because I was told that most likely I would die from it. And I was told about a young lady who my doctor knew of, my infectious disease doctor, of an 18-year-old female who had the same kind and died within 2 weeks of being diagnosed. So I started digging into all this information. I thought I was on a perfect health food store diet based on what the media, what I was told was the perfect health food store diet. High carbohydrates. I was told carbohydrates are good for you. Oh, it fuels the body. It gives you energy. It's good for you. It helps you build muscle. Oh, it helps you build muscle, all right. It makes you sick. Excessive carbohydrates. I didn't eat anything processed. And in this interview that Tucker did, they talked about processed foods. I didn't eat processed foods. I ate what I was told to eat, which was wholesome, healthy, whole grains, starches like potatoes. Oh, they're good for you. And rice. Oh, now white rice, brown rice. And I got the worst kind of belly fever you can get. You know why? My body was a petri dish. I was feeding the infection, a fungal infection, a microorganism that lives off of sugar, carbohydrates. When I left that doctor's office and he told me I might die from it, I had two young kids, one 4 or one 6 and one brand new. I said, I can't die. I want to live. And a lovely, beautiful wife who I love so much. So I started reading and researching and found out it was my diet that was feeding the infection. And I made a 180-degree turn and went the opposite direction. You know, if these microorganisms live off of carbohydrate, sugar, and they live in me, I'm feeding them, and I don't want to die. So I changed my diet to low carbohydrates, the one I first started out on back in the 70s, but got away from for a short time and got sick. And that's the very diet I'm on today. No medications for that sickness. It's in me still, but I'm not letting it have its food so my body can control it using my immune system. And so interestingly enough, you're going to find all the things they talk about here are all tied to our diet, to our nutrition. And even mentioning in the interview how meat doesn't make you sick because we're being told by the media how bad red meat is for us. They want you sick. They want you unhealthy. When you look at these stats, you just want to make you puke. Now, her brother worked for Coca-Cola. And he says in his interview with Jesse Waters, the most important issue in the world, which is that we're getting sicker, fatter, more depressed, more infertile because of food. 8 out of 10 leading causes of Americans today are directly tied to food, reversible by food. But we are being gaslighted from that fact. It's because of the rig system. 3 particular levels I saw when he worked for Coca-Cola is that food companies directly pay medical groups. Now listen to me closely. Coke has funneled millions of dollars in the American Academy of Diabetes, the American Academy of Pediatrics, who said the American Nutrition Association, they've accepted millions of dollars from Coke. What does that buy? When we drink diabetes water, sugar consumption going up among children 100 times in 100 years. We have silence from the American Diabetes Association on sugary drinks when 25% of teenagers now are pre-diabetic. Pre-diabetic as teenagers. There are also, as you very aptly pointed out, research institutions. What does that get? What does that, 11 times more from food than the NIH? What does that get? It gets the doctors on USDA nutrition guidelines. Right now, shamefully, and I believe this is the most shameful violent policy in America, the USDA, our own government, says that a 2-year-old, it's okay for them to have 10% of their diet from added sugar. It's a systematic rigging of the institutions of trust. I mean, this is not complicated. And early in my career, I saw this. Unimpressive PR executives sit around conference rooms and ask, how do we rig? How do we gaslight people, in a rebellion way from not believing what's right in front of us? 80% of American adults are overweight or obese. 50% of adults have pre-diabetes or are diabetic. I can go on and on and on. It's disgusting. And I'm here to give you the information. So hopefully you can take some of this away from my show and make some of these changes. There is no food on this earth that's worth you being sick. There is no food on this earth that's worth you paying your family's riches to buy drugs to treat the sickness caused by food. Because all they want you to do is to be sick and fat. You're listening to Good Life with Lance or Dr. Fitness. I'm not mad, by the way. I'm a happy guy. We're going to take a break. We'll be right back. All right. So we're going to get back into this stuff. When I was watching that, I was in a meltdown mode. I sent it out to my siblings. My wife was watching it. She says, honey, you got to be careful. They're going to come after you when you start to talk about it. I said, I've got to say this stuff. I've got to say it. It's me. People have to know. You have to be skeptical. So I pull up an article, and I brought this up before. This is in the Daily Mail, only out a couple of months ago, in bed with Big Pharma. Corruption fears as report finds U.S. doctors received record $12 billion in pharma payments in the past decade. Orthopedic surgeons were found to receive the largest total sum of payments. Top drug companies related to industry payments were blood thinners, Xarelto, and Eliquis. Anyhow, here's the article. Enjoy this. Absorb this. Learn from it. A study by researchers at Yale University found that 57% of doctors earned the huge sums from manufacturers in relation to medical drugs or devices between 2013 and 2022. Most of the money was for consulting services or fees for things such as serving as a speaker at a venue. But the physicians also received large amounts of money for food and beverages and gifts. Orthopedic surgeons were found to receive the largest total sum of payments at $1.36 billion. And the most common drugs related to payments were for blood thinners like Xarelto and Eliquis. One medical device found to be in the top 5 medical devices related to the industry payments was Impella, a device used in some types of heart surgery. Some Impella devices were recalled in December by the FDA due to perforation risks, which may cause serious injuries or death. Despite evidence of financial conflicts of interest may influence physicians prescribing and may damage patients' trust in medical professionals, such payments remain pervasive. And researchers wrote, doctors, here's the specialty fields. Orthopedics, $1.36 million. Psychiatry, neurology, $1.32 million. Cardiology, $1.2 million. Hematology, oncology, $825 million. General practice, $588 million. This is money kickbacks. These are kickbacks from Big Pharma. Endocrinology, $546 million. Family medicine, $479 million. Rheumatology, allergy, immunology, $464 million. And it goes on and on. Then you get down to the big drugs. Xarelto, Eliquis, Humira, Invokana, diabetes medication, Jardiance, which you see people dancing around the little pill with a big story. I mean, when I watch that commercial, I want to throw my shoe at the cotton picking TV set. The little pill with the big story, as they're showing people that are excessively overweight dancing around on the television set like they're happy. They're not happy. Believe me. They're unhappy. No one wants to have a health issue. If you have a health issue, how happy? I'm happy. I'm a diabetic. I'm not happy. I wasn't happy when I was diagnosed with disseminated valley fever. No, that sickness doesn't make us happy. Healthiness makes us happy. And the only way to find healthiness is by exercising and eating the right food. And the big scam is, what are they telling us the right food actually is? That's the big scam. They keep pushing down our throats. You got to cut the red meat out. The red meat's causing cancer. The red meat's causing heart disease. The red meat's causing dementia. No, it's not. Processed foods are. We have the worst kind of processed foods. James T. and his wife, smoking hot, just got back from Ireland. And he told me the food was so much different there. You know why? It's not processed. I spent 4 years there in the UK. I've traveled all over Europe when I was a professional bodybuilder. And I noticed it was different back then. That was 40 years ago. They used to hang chickens in the butcher shop window, in the window, not the refrigerator. Skin wasn't white, it was yellow. Fresh vegetables, fresh fruit. They would put milk on the top of the refrigerator and cream would sit on the top of it. And they wouldn't put eggs inside. And the food tastes better. So it's all about our diets. And the food industry here has been in cahoots with Big Pharma for years to get us addicted to their whatever they process and put out. So a couple big things happen. We get addicted to what they're making, and we get addicted to what they make us take to deal with the symptoms of our sick problem. And our sick problem is heart disease, cancer, diabetes, dementia, osteoporosis, allergy. I can go on and on. Autoimmune diseases. When you look at 8 out of 10 Americans over the age of 55, 8 out of 10. Now, they said in their interview, 50% of adults. I'm talking about 8 out of 10 Americans over the age of 55 are either diabetic or pre-diabetic. 8 out of 10. Oh, they're clapping. Yeah, it's working. It's working. It's working. Well, all the stuff we're telling these people to eat and drink, it's working. We're getting sick, fat people, and we're making money off of them because we're coming out with drugs to treat the problem that we caused. And, of course, your stockholders, they're happy about that. And in the interview, Dr. Means mentioned about a bill in Congress right now. H.R. 4818 that deals with reducing obesity by making these medications like Ozempic available for people who are obese through Big Pharma. Oh, I wonder why. I wonder why. And of course, we know that Congress, they're exempt from the inside trader law. Did you know that? I don't mean to turn my show political. I don't try to do that. But food is political. So they know this stuff. I'm going to buy me some stocks in some of these companies like Pfizer. And I'm going to get myself real rich off of people who are overweight because they're going to take the drug that I just said is okay to take. And we're going to pay for it. You and me. So take what I am saying and embrace it in your own life. It's all about overconsumption of sugars, carbohydrates. It's in everything. It's cheap too. Ramen noodles, those cheap, aren't they? Spaghetti. Oh yeah, you can buy yourself a package of spaghetti, make a big pot of this stuff for about $3. If you buy the cheap version of it, the stores brand, probably about $1.50, $2. Fills a whole pot. Pure starch, pure sugar. So you may be sitting and saying, what do I do, Dr. Fitness? What do I do? You know what? Get someone to help you make these lifestyle changes and make you accountable. Now, back into the topic. We've been lied to. We've been cheated for so long. And I've been preaching this story since the 1990s. And everyone's starting to jump on the bandwagon. Everyone. They're embracing Dr. Fitness's lifestyle out the yin-yang. So the question is, why doesn't the healthcare industry do this? Because money comes from big pharma and from food companies. This is from The Guardian. Low-carb diets work. Why does the American Diabetes Association push insulin instead? And this is one of the drugs that the Biden administration is taking credit for. Oh, we got insulin costs down. Well, if people weren't diabetic, primarily type 2, which we've had an explosion in, you wouldn't need insulin. Why does the American Diabetes Association push insulin instead? For a glimpse in how big business influences a $4 trillion U.S. healthcare system, look no further than the world's most powerful diabetes advocacy and research nonprofit, the American Diabetes Association. Diabetes afflicts 38 million Americans, with another 90 million considered pre-diabetic. Every year, the disease claims the lives of 100,000 people, Americans, and disproportionately affects people of color. It is also ruinously expensive, as doctor visits, hospital stays, insulin, blood test strips, leg amputation. Sounds good, doesn't it? Continuous glucose monitors and numerous glucose-lowering drugs add up to $400 billion a year. To put it bluntly, we are losing the war on diabetes. And like many other diseases, such as certain cancers, Alzheimer's, kidney disease, or Crohn's disease, type 2 diabetes is reversible. This bears repeating in elaboration. Numerous nutritional studies have shown that diabetes can be reversed through a strict diet low in carbohydrates, the macronutrient that people with diabetes cannot metabolize without the help of drugs. The ADA concedes this, but you wouldn't necessarily know it from the drug therapies or the food companies and recipes that the organization recommends to people suffering from the condition. In 2020, the then American Diabetes Association president, Tracy D. Brown, rocked the diabetes world when she disclosed that she had type 2 diabetes and had gotten off of insulin and other medications by adhering to a low-carbohydrate diet. Eat like Lance. Here's what to do, and it's pretty simple. She said in an interview that might have made the ADA's pharmaceutical benefactors crazy. Elevated blood sugars happen when you have sugars in your body and you don't have insulin to manage the sugars in your body. Carbohydrates turn into sugar. So I just try to get people to be aware of how many carbohydrates you're actually putting in your body. Duh. She was able to get off of insulin, and as far as I know, this is a couple years ago now, she's off all medications for type 2 diabetes. The average diabetic in this country, type 2, most of them, is putting out of pocket upwards of $14,000 a year. And that's without complications, hospital visits, or other things tied to the sickness. $14,000 or more. Then we have the cost that you and I, the taxpayers, are paying for this. And the cover up here is the American Diabetes Association. They know. But a lot of their money is coming from big pharma and food companies. Oh, yeah. Their donations come from those companies. And what do? They shut up. We can't say nothing. We can't upset the apple cart. We can't get the, our bread and butter upset. How we make our money. We don't care about the patient. We care about the bucks. Oh, yeah, let's get Ozempic on this stuff, too. Oh, that's a diabetes medication, by the way. But let's get all the people who have weight issues able to get that drug. And you and I pay for it. Let's do that. And then all their stocks go up. And perhaps the most profitable medication in the history of pharmaceuticals will be that drug. And everybody's jumping on the bandwagon. They have all their different versions of it. I'm ready to introduce a berberine product that does more than that without the side effects. I'll keep you posted on it. It's called berberine, Lean. I'll keep you posted. So she's saying here, by cutting her carbohydrates down, she was able to get off these drugs. You don't find the good life in a pill. You find it in lifestyle. Just like I did 30-some years ago when I was diagnosed with disseminated valley fever. And I was following the perfect health food store diet. Nothing processed at all. Whole grains, high carbohydrates, good for you. And I got sick. Sick as a dog. And of course, being that we're from the Southwest desert, valley fever is big time out here, particularly this time of year when you have a dust storm. But none of your infectious disease doctors, I can tell you this right now, they're not out here recommending eat like Lance. Put you on ketoconazole or itraconazole or diflucan or any one of the antifungal drugs. Extremely expensive, by the way. Put them on that. And, of course, your animals, too. Get your animals on these, too. Bad, bad, bad. It's lifestyle, exercise, diet, what's in your head.